Why were ACA subsidies created and challenged legally? Imagine trying to buy health insurance but finding it too expensive to afford. That's where the Affordable Care Act, or ACA, stepped in to help millions of Americans. The main goal was to make health coverage more affordable and accessible for people who didn't have employer-sponsored insurance or qualify for Medicare or Medicaid. To do this, the law introduced subsidies, which are financial assistance programs that lower the cost of insurance premiums and out-of-pocket expenses. These subsidies are called advanced premium tax credits and cost-sharing reductions. They help people with incomes between 100 and 400% of the federal poverty level pay less each month and reduce their medical costs when they seek care. The idea was to encourage more people to sign up for health insurance plans through the marketplaces, which are online platforms where individuals can compare and buy coverage. By making insurance more affordable, the ACA aimed to increase coverage rates, improve health outcomes, and lower overall healthcare costs. This was especially important for those who might otherwise skip necessary care because of high costs. However, these subsidies didn't go unchallenged legally. The biggest controversy was about where the subsidies could be used. The law states that subsidies are available for insurance purchased through an exchange established by the state. Some courts argued that this meant subsidies should only be available in states that set up their own exchanges. But many states chose not to create their own marketplaces and instead relied on the federal government to run them. This led to a major legal case called Kingv Burwell in 2015. The Supreme Court decided that subsidies are available in both state-run and federally-run marketplaces, which was a huge win for the law's supporters. This decision kept millions of Americans receiving financial help to buy insurance. Other legal challenges focused on issues like the family glitch, which meant some families couldn't get subsidies because the law considered only the cost of employer coverage for the worker, not the whole family. Over time, legislative changes and administrative updates have worked to fix these issues and expand access. Recent laws like the American Rescue Plan and the Inflation Reduction Act increased subsidies further, making coverage even more affordable for higher-income households and encouraging more people to enroll. In summary, ACA subsidies were created to help make health insurance affordable for many Americans, supporting the law's goal of expanding coverage and improving health outcomes. Legal challenges mainly questioned where and how these subsidies could be used, but courts have generally upheld their broad availability to ensure the law's original purpose is fulfilled. As policies continue to evolve, efforts are ongoing to address gaps and ensure more people can access the coverage they need. Remember, for personalized advice about health insurance options, it's always best to consult with a healthcare or insurance professional.